Well, we first moved to Hinsdale in 1976. Paul's been a doctor. I was a nurse. I worked at a preschool for a while.
Our children were both born there, so we think of Hinsdale really as our community hospital.
That day started off like a normal day. We were staying in the kitchen talking, and you'll have to go from here because after that I just crashed.
Rita just collapsed. I was scared, and I kept just praying that she would just kind of shake her head and wake up. Real quickly made a 911 call, and everything between the emergency medical people and their coordination with the emergency room was fantastic. She was swooped right into one of their primary treatment rooms for cardiac events, and they went to work, and it's amazing to me. I'm a medical doctor, I've been doing this for many years, but to see the coordination, I was just overwhelmingly impressed.
The rapid response by the emergency room nurses, repleting her electrolytes, getting her rhythm under control, initiating certain medications, saved her life immediately. It was clear she was in the midst of a cardiac arrest. She was in an extreme state. She did not have a rhythm. She did not have a blood pressure. She was really unresponsive, and I was not sure whether there was brain function left. There was a relatively new protocol in the emergency room which was called hypothermia. Now, hypothermia means that if you put this blanket on a patient and drop their temperature several degrees below their normal body temperature, it slows down the metabolic processes and allows potential healing of tissue that's severely compromised. We had her body temperature drop significantly. We started treating her for some electrolyte abnormalities that she had, and ultimately we found that she had a blocked artery that we fixed also.
Those patients typically ended up in a vegetative state, meaning that they are just alive, having heartbeat, they're breathing, they may look at you, but no brain function.
So when she did come out of hypothermia and she arrested again, we put her back in, which is not characteristic. You usually leave them in for 24 hours. I wasn't going to give up on her, and I actually told the family that, don't give up until we have her off of this. The rewarming process was very challenging, and it always is for every hypothermia patient, because as you're warming them, their electrolytes do tend to become erratic again.
It was a roller coaster. In the morning we would be sending out, making some phone calls saying things look good, and in the evening the call would say disaster. We'd say, can you squeeze my hand? And you'd think she was squeezing, but you almost didn't know if that was her squeezing or your imagination thinking she was.
And one of her sons had his iPod with him and was playing the voice of her grandson. And I just remember her turning to the iPod and with her head and just listening for the voice and squeezing our hands and letting go of our hands and wiggling her toes when we said, and it was the best feeling. It was, brought tears to my eyes.
Her blood pressure came up, her heart rate came up, her mentation slowly improved, she was moving all body parts, and it was a remarkable transformation.
I think that's what's so wonderful for my family, that when I did wake up, I was still me.
From the most senior cardiologist to the nurses and the technicians and the people that brought her meals, everything was done wonderfully.
At the end of the day, it's not always easy, but the thing that keeps me going is the fact that you have patients that do survive like Rita. I get emotional every time I see her. Her and I both cry. We both have tears in our eyes. You can't even explain the emotion. I could cry right now.
In another hospital, which does not have this technology, Rita's life would have been totally different.
And we're buying equipment, at least in our cath lab and in the intensive care units, not out of their fiscal budget sometimes because they don't have the funds, but they say, we do have extra funds in the foundation and we'll take advantage of that money. And so the foundation was in large part helped provide this equipment that we needed to save Rita West's life.
I've gone back 3 or 4 times to cardiac care. I just want them to know that they will forever be an important part of my life. And I can't thank them enough. I feel like I've had a whole new life. It's just unbelievable. That is my hospital. It has taken care of me very well.